for staying with us. You're still watching The Breakfast on Plus TV Africa. Right now we're discussing improving your overall health. Today we're talking about something that affects all of us, our smiles, and you can see mine. Oral health is a fundamental part of overall well-being, yet it is often neglected. According to the World Health Organization, nearly 3.5 billion people worldwide suffer from oral disease, with untreated tooth decay being one of the most common health conditions globally. Many of us follow daily oral hygiene routines, but are we doing it correctly is the question. From common brushing mistakes to the impact of diet on dental health, today we'll be exploring the science behind a healthy smile, debunking common myths, and discussing the latest advancements in oral care. Joining us this morning is a general dentist who is passionate about enlightening patients on the importance of prioritizing oral health for their overall well-being. She's a graduate of the Obafemi Awolowo University, Ile-Ife, with over 10 years of experience and various certifications. Ladies and gentlemen, we have Dr. KATHERINE Njorteah in the studio. Good morning. Thank you for joining us.
Good morning, Rume. It's good to be here.
Lovely to have you.
Thank you, Rume.
Yeah, so we're speaking about oral health, and last week Thursday was Oral Health Day, right? And I think the theme for this month was obviously happy smiles or something.
A happy mouth is a happy mind.
Fantastic. So let's talk about that. Raising awareness. Obviously, there's a day dedicated to this. Yes. That means there is a problem that is prevalent in the world, not just Nigeria right now. How important is your oral health?
Okay, so March 20th every year, globally, is being set aside to celebrate the World Oral Health Day. I mean, on a daily basis, this is what we basically do, preaching the gospel of dental health.
Ooh, I like that.
We choose a particular day to be able to raise awareness with a specific theme, as you already mentioned, and a specific tagline, this year being, a healthy mouth is a healthy mind. We basically aim to raise that awareness and create lasting and positive changes in people, making them realize that when you prioritize your overall well-being with your mouth as well, you're doing a lot of good to yourself. I mean, let's face it, we know that a lot of people have dental phobia. So on a daily basis, we're constantly trying to help people overcome that fear and take that first step towards actually achieving a good oral health. Now, we know that with a healthy mouth, you can actually boost positivity, boost your productivity, because you're not having to take time off work to address dental issues. You improve your self-esteem, your confidence, you're able to socialize better, and then you just have that overall quality of life being enhanced. On the other hand, when you have neglected your dental health, you have dental issues that haven't been addressed, it affects your life. I mean, nobody wants to enjoy their meal with a toothache somewhere. You're not able to socialize when you've got bad breath. Also, it just gives you anxiety, and at the end of the day, it just affects your overall being. And also to add that the mouth and the body are actually interconnected. It is part of the body. The mouth is actually a pointer to certain systemic conditions going on. You neglect your oral. Sometimes we've been able to identify patients with underlying medical conditions just from certain things we see in the mouth. Oh, wow. So we can go on and on about how this actually affects. Just to give you a quick example, on Monday I had a patient come to me, and this person says, oh, I was in church on Sunday and I didn't quite like the reaction I got from a friend. What does that say?
Bad breath?
Bad breath. I need you. This is between Sunday and Monday. And this person says, you know what, I need you to check.
Oh, wow.
Just yesterday, I had another person who said, oh, I'm always so busy, but guess what? This toothache is here. You need to fix this.
Yeah.
Because
your life stops, if you have issues. And with that being said, what are some of the hidden dangers in the mouth? There might be warning signs. I mean, for me, I came to you, I was there, I visited the dentist this week, so that's why my smile is so brightened at the moment. And for some people, when they come in, you'll find out that they probably have a tooth decay, but like you said, it's not something that started one day. It has been happening over time. So what are some of the hidden dangers of the mouth and the warning signs that we definitely need to be looking out for?
Okay, great. So we start with the simplest complaint a lot of people come in with, and that is bleeding gums. What does that speak to? It speaks to the fact that you have deposits in your mouth, what we call plaque, a sticky thin film that forms on the surfaces of teeth, usually around the gum line. So once you start experiencing bleeding gums, that's your mouth telling you something that it's time to pay a visit to the dentist, because our daily brushing would not be able to take care of those deposits rather. So once you start seeing the bleeding, you know it's time to get a professional clean. That's the simplest. That's where to start from. Never been to a dentist.
That's me, having my cleaning.
Nice time at the dentist. She got her cleaning done. And her smile enhanced. I mean, you see the 1,000-watt smile of Rume now. So that's the first thing you want to start with. So I get people saying, oh, I have bleeding gums. And the first question is, have you ever been to a dentist? So even for you, you cannot have that interaction with people and then you hear things like, oh, I think I have a foul breath. Have you been to the dentist? Then we move on to sensitivity. That's another common condition people present with. And that has to do sometimes with diet, you know, excessive consumption of certain foods.
Which is my next question, How does your diet impact your overall health?
So I'll focus on two areas a lot of people present with. First, cavities. That has to do with excessive intake of sugary diets, sugary foods. We know that in the mouth, we've got residents. I think I have
I'm guilty.
So in the mouth, we've got bacteria that ideally should be protective, but when they get overwhelmed, act on the sugar in the mouth, they begin to produce acids that actually cause decay. Now, there's this chart I have, and I'm hoping we can project that. The truth is, toothache never starts overnight. It's always a process. There's a time factor to it. So the reason why we encourage people to show up early is because as dentists, we're able to pick the signs, what we call a pinpoint cavity. You can actually detect that at that initial stage. And that's the best time to intervene, because we're here to actually preach early intervention. We're here to preach preventive dentistry. We do not want people to go through the stress of dealing with a toothache. I mean, it can be really uncomfortable. And that's what, at the end of the day, instills all of that fear in people. And then people tell you, oh, I had an awful experience. And that's because you're presenting when it's rather late. And we do not want that for anyone. I've seen parents actually transfer the phobia they've had from dentists
to their children.
Yes, I have a patient. Her daughter is 21 and she has a mouthful of dental conditions. And we do understand these things. So this is what we're here to preach and emphasize, that yes, we understand that, you know, people might have had experiences in the past that didn't go down well with them. But dentistry has evolved. There are a lot of nicer ways to go about doing things. I mean, at the clinic, as part of our celebration this year, we had some wonderful kids over. I mean, if you head over to the clinic's Instagram page, SS Dental, we had a lot of amazing kids, 3 to 5. What are we trying to achieve? We wanted to introduce them to the dentist at a very early stage. Because when we create that environment for them to come, it was such a fun, interactive session.
That's beautiful.
We used, you know, very common words, made it very playful and interactive. But at the end of the day, something actually went down there. People were able to understand. Their teachers were able to understand. Those kids would go back home, and hopefully we've been able to help their parents. But now they would look forward to their dental visits. So again, it's really about the common conditions: bleeding gums, excessive intake of sugary diets that can result in cavities. And the truth is that when this thing starts, because we know in this part of the world as well, a lot of people tend to have this management mentality. Oh, let me manage. It's not, you know,
so it's too late.
It's too late. Okay, so we don't want that to happen. We had an outreach one time where we actually went to a school, and I was appalled at the things I heard. I heard kids saying things like, oh, I put petrol on my tooth.
What? Please do not do that.
Yes, please do not do that. But thankfully, with the help of an NGO, we were able to go back to actually help the indigent kids resolve their dental issues.
Yeah, that's quite fantastic. There was something that you said which talked about, you know, preventive dental care. So you don't have to wait for it to get too late. A lot of people, the first time they're probably visiting the dentist is when they already have toothache, and 9 out of 10 times that tooth has to be removed. But in my own case, I mean, I came to see you just for me just checking out my teeth and ensuring that my smile is enhanced. And then we found out that I already had some stickiness in my teeth, which could lead to a cavity. And in order not to have a cavity, which would now lead to a bad tooth, we needed to feel that at that point. So what are the ways you can tell people to ensure that they maintain a healthy lifestyle in tandem with visiting their dentist regularly, how often should you go to the dentist, especially if you're looking at preventive dental care?
Okay, let's start with the things you can do at home.
Yeah.
We start with brushing. Okay, the brushing, it's really important. We're talking about frequency here, twice a day. I know, we all live very busy lives, but that shouldn't be an excuse not to actually pay attention to your brushing. So you want to brush in the morning, of course, and at night. And then flossing. Flossing is important. It helps get rid of debris, particles in between your teeth and your gums. We can also incorporate the use of what we call tongue scrapers, because your tongue health is actually very important. A lot of people that come to us with halitosis, bad breath, actually neglect cleaning their tongue. So you can get a tongue scraper. It's a cute little tool which you just introduce from the back of your tongue. Just gently bring it forward, and it helps scrape deposits from your tongue. And then we want you to brush for at least 2 minutes. That's the minimum, really. With the kids, we give them these little cute timers. Again, just fun ways to ensure that they're doing things right. For the visits, we encourage you to see your dentist every 6 months, okay? Want to get your cleaning done, because like I said, the daily brushing is not enough. It's just not enough to get to the difficult to reach areas. We're able to get in there. But more importantly, we're able to pick early signs, pinpoint. We're talking about, there's a little tool called the probe. Just imagine a pin or a needle. We're able to detect at that level. Of course, we've got gadgets as well. That are we're able to show you that you actually have a cavity starting in particular areas. For the diet, you want to also cut down as much as possible. Cut down on excessive consumption of sugars, because we know that these are the #1 culprits, sugary diets and drinks. We want to avoid as much as possible tobacco and smoking as well, because of the detrimental effects. We're talking about bad breath, delayed healing. It increases your risk of oral cancer.
It even stains your teeth.
It stains your teeth. It alters your sense of taste. So you don't want all of that to go on in your system. Like I said to you earlier, bacteria in the mouth can actually travel through your bloodstream, and then it gets to other areas and causes cardiovascular issues, autoimmune conditions. So it's so important that we do not neglect our oral health. Same way you try to prioritize your annual wellness checks for other parts of the body. It's important to pay attention to the mouth. 6 monthly visits, your cleaning is done. Because again, with those cleanings, you might just think it's just scaling and polishing. When you've not done your cleaning, remember I said it starts as a thin film around your gum line that results in bleeding gums. But when that is not attended to promptly, it becomes hardened. We call that tartar. Now, tartar is a lot worse. It could actually lead to deposits that could irritate your gum. It pushes your gum line away. With that, there's sensitivity, and then lose.
That's a lot,
That's a lot.
That's a whole lot. I think having to ensure that your diet is proper, you're eating the right things, you're not ingesting unhealthy foods for yourself, and smoking and all of that. That's important. Visiting your dentist as well. But there is a misconception. I don't know if it's a myth, right?
Tell me.
We have to end right now, but I just want you to answer this. I've heard about baking soda, right? Having to use baking soda on your teeth. In fact, I'm a culprit, let me be honest. I've actually used baking soda on my teeth before because I wanted my smile to be enhanced. Is that something that you advise as a dentist? Is that something that can work? Because thinking of the enamel, thinking of the composition of your teeth, should that be something that people should even use at all?
So we're usually careful. We know that these days there are a lot of things you can get. DIYs, a lot of DIY fixes. But you really, really want to be careful, because sometimes you can't really vouch for the composition of those things. We're not saying that natural remedies are completely bad, but we're saying you want to be really careful and as much as possible seek medical care, seek dental care from professionals. Because at the end of the day, you really think dentistry is expensive. It isn't. Ignorance is. The dental issues that you're neglecting would someday become more expensive treatments to be carried out, and we really don't want that to happen.
Well, fantastic. I think that is such a good way to end the show right now. It's important that you improve your oral health. That's something that we've been discussing. And in improving your oral health, why not make sure that you see your dentist every 6 months? Make sure that you're improving your diet as well. So the things that you're putting into your system, it matters a lot. And if you have anything, if you feel any pain, any discomfort, visit your dentist, do your scaling and polishing, and if you want to enhance your smile, why not? This is how much you can take on the show right now. Thank you so much for having the breakfast with us. I've been speaking with Dr. KATHERINE Njorteah. She's a general dentist, and she's just been speaking on improving your overall health, so it's important that you do that right now. So this is where we have to wrap it up on the show. My name is Rume Paulson. It's been a pleasure having the breakfast with you. I'll see you again on Monday. Have a wonderful weekend. Good morning.